Good day, everybody. My name is Vikram Shee, and I am an international medical graduate and an applicant for the 2023 Internal Medicine Residency Match. I'm here to speak to you about a U.S. clinical experience, a rotation that I had recently participated in at Brooklyn Cancer Care. Brooklyn Cancer Care is an outpatient hematology-oncology clinic and infusion center. The clinic is supervised by Dr. Ratesh Khillan, a hematologist-oncologist who is board certified with over 20 years of experience in the field and who is also an assistant professor at SUNY Downstate. This review may be of interest to international medical graduates, much like myself, who are considering participating in U.S. clinical rotations, but are on the ropes of whether they should apply to Dr. Khillan's clinic, or international medical graduates who have already applied for a rotation at Dr. Khillan's clinic and would like to know what to expect. Finally, this may also be very useful for program directors who are looking to find out what students of Dr. Khillan at Brooklyn Cancer Care were actually up to during their rotations. During your first week at Brooklyn Cancer Care, you will participate in a structured orientation which was developed by Dr. Khillan himself. The orientation will teach you about the processes in the clinic, how to use the electronic medical record system, your future responsibilities in the clinic, and also will teach you about all the various stakeholders involved in the delivery of patient care and how to communicate with them in order to solve everyday problems. Additional to this, you will be paired with a different senior student who has, of course, been there much longer than you, in order to benefit from the experience of these students in your practice. Finally, and perhaps most importantly, Dr. Khillan holds a meeting with every single student face-to-face in order to better understand their circumstances, where they're coming from, and what they hope to achieve from this rotation. Based on these meetings, he goes out of his way to provide you personalized advice on how to succeed in the U.S. healthcare system. Let's talk a little bit about the clinical responsibilities that you will have while at Brooklyn Cancer Care. Dr. Khillan will expect you to see 3 to 5 patients every day in a private clinic room assigned specifically to each student. Subsequent to asking a detailed patient history and recording this history, you will be expected to study the patient's previous records and identify any missing records or missing medication lists. You will then be expected to contact third parties and other stakeholders such as pharmacies and physicians' offices to ensure that you have all the patient's records at hand that will be required for the subsequent patient decisions. Dr. Khillan will subsequently enter the patient's room and ask his own patient history, discuss the case with you, and better try to understand your proposed management strategy. He will then propose a final management strategy which he may expect for you to implement. This involves sending out orders for blood tests, laboratory tests, and imaging investigations by yourself, or even helping to prescribe medications. Of course, all of this is under supervision. Finally, I'd like to speak to you about the academic opportunities that you will have while rotating at Brooklyn Cancer Care. During your time here, Dr. Khillan will organize a seminar every week. He expects that students will present on topics of interest in hematology and oncology before the end of their rotation. During these presentations, Dr. Khillan will provide his own personal input to contextualize textbook knowledge in a clinical form. Furthermore, subsequent to these presentations, Dr. Khillan will hold group discussions and allow questions so that students could learn more about these topics in hematology and oncology.
If you're interested in applying for this rotation, please make a note of the contact information provided below. Finally, thank you for watching. If you found this video useful, remember to like and subscribe.